Spring is almost here, and allergy sufferers are on high alert.
In fact, according to pollen.com, the allergy alert for this year for the Bay Area is medium to high, and it's already starting.
And for more on this, we are joined in studio by KTVU medical expert Dr. Larry Burchett. Good morning, doctor.
Good morning, crew.
So I never had allergies until about 2 years ago.
Right.
Painful, terrible. I hate them. Why all of a sudden did I get these?
Some people can develop them later in life. Some kids have them. Allergies affect up to 10 to 30% of Americans. That's tens of millions. That's a lot. It's significant. Like you said, being miserable. Some people get so bad that they're depressed. So these are significant.
But is it something I did? Is it something in my diet? I mean, or is there? We
Not
just don't
enough
know the
sleep,
science
perhaps?
about it. Maybe 4 hours of sleep.
I don't think you did anything wrong. Your immune system, for whatever reason, now is reacting to a benign allergen in the environment.
I've had allergies all my life, and as I got older, I don't treat them anymore unless it gets really bad. I'll take Benadryl or something. Could I have a better quality of life if I got shots or treated it? Or, you know, the way I do it, it's like when it gets really bad, I pay attention. If it's just moderate, I suffer.
Well, that's a good question. So I would say, why don't you try some of these things that I've got here to talk about?
Okay.
So we talked about this earlier. What are some of the most common, or what you see on TV a lot, allergy medicines?
Yeah, I just keep hearing Benadryl. You know, you hear the commercials. For some reason
Benadryl.
that pops in my mind.
That makes
There
you
we go.
drowsy. You know, that is great, but it makes you drowsy.
Absolutely. So it's called a sedating antihistamine. It's effective. It works a little bit, but it makes you tired. So then they came up, they said, well, what if we had an antihistamine that wasn't sedating? That's Zyrtec, and that's Claritin. I see people that come into the ER sometimes, their allergies are so bad they can't sleep at night, they can get a cough. You know, we're mainly talking about itchy eyes and nose. Runny nose, congestion, it can go back and make you cough too. In my experience, these work, but just a little bit. They don't do very much. So what works instead? This thing right here, Sal, I would suggest you try this. Either Rhinocort or Flonase. This is over the counter, like 10 or 15 bucks. I just bought it this morning. And you spray it into your nose. It's a nasal steroid, so it calms it down from the source. It's not a pill that goes systemic. It's not going to make you tired. It's not a lot of steroid that's going to kind of systemically give you side effects. This changes people's lives.
So do I take that, because we had to turn around from a family hike up in the Oakland Hills last spring because I was so miserable. Do I take this before we go to the family hike? Do I have it in my pocket during the family hike? What's the timing on this?
So this is more of a preventative.
Okay.
Allergy season's coming on. Flu season we're about done with. We know that we had a lot of rain, which means there's going to be a lot of grass and pollen and flowers out there. I would take this to prevent it.
An hour
when things
before?
get bad, no, like a day or two before.
Oh.
I don't know that it's going to work that quickly.
I can't plan my life like that.
But I think it would still be worth to try this.
Okay.
Now, there's other things. So when it flares up really bad, people love this one, like Afrin. I hate this medicine because it works really good initially, and then your nose gets a little dependent on it. It can have this rebound effect. So if you're like really dying, like you're saying there, going on a hike, you might try that, but don't do it every day for a week or you're going to get stuck with persistent nasal allergies.
So you actually make the situation worse. Okay.
Exactly.
I'm hesitant on the spray thing because remember during flu season they started trying the spray flu instead of the shots, and then some pediatrician
Said the shot
talk
was
about my
more
children,
effective,
but
right.
pediatricians were pulling back on it.
Because
And
it
said,
didn't
you know,
work,
and I did the spray actually myself, and I
Just
think
take a
I
look
got
at that
some-
bad boy.
Like.
It's up to you. How bad are your allergies?
But is there something to say about spray
What
versus an
about-
actual pill? Like, are you going to get...
Spray is better. It's more localized. It gives the medicine exactly where you need it. Doesn't go to the rest of the body, and that steroid is effective.
What about allergy shots for people who are, you know, like once a week, maybe you get an allergy shot?
So for shots are, I mean, exactly what you said. So they take more time. They hurt more.
But do they
usually
work?
They work. We reserve that for people that have severe allergies who have gone through a couple nose sprays. Maybe you add on Claritin or something. Still not working. It's refractory allergies. Then you would do the shots. But yeah, they were effective.
I imagine you're seeing allergies pop up in your patients sooner, and I'm expecting them to last even longer.
I agree. I think it's going to be a rough allergy season for those who get seasonal allergies. Some people get it all year round, suffer, and they're very familiar with these medicines. But then there's a group of people, a lot of people, who spring comes around, pollen, you know, flowers bloom, grass is growing everywhere. You know, it's beautiful, it's green, and it's allergies.
We all have kids. When should we start watching? At what age do you start watching kids for them developing symptoms of allergies?
You know, I see a lot, especially around the toddler as they're getting out there, getting outside more. You can confuse pink eye you know, crusty eyes, red eye for allergies. So keep that in mind. And then another one is a cough. So we commonly get a cough with a virus, but then also, like we talked about with nose allergies, it can drip in the back of your mouth and cause a cough in a kid. So if it doesn't go away like a virus should, you know, a cold should go away days, maybe a week, 2 is long. But if you're like, gosh, it's spring, my kid has this cough that's persistent, think about allergies.
Okay.
All right, Dr. Larry, appreciate it.
Do you want
Thanks,
this
guys.
back? I know you paid $15
I kind of want to give it to Mike or
Okay,
Sal
well,
and
here, I
have them
can-
try it.
I'll sit on it for a while. We'll think about it. Coming up
Thank
next
you.
on Mornings on 2 to 9, it's called the Hazel Ranger.